Liverpool's coronavirus case levels have continued to decline. Mass testing also continues to develop in Liverpool as an evaluation of the pilot project begins. Public health officials, though, have warned people against viewing the testing as a freedom pass, with public health officials saying individuals allowing themselves to be lax with social distancing and other measures after a negative test increase their risk of exposure. With batches of the COVID vaccine beginning to arrive at hospitals around the UK, NHS England's medical director, Professor Stephen Powis, warned that it may take months to vaccinate everybody.
The rate of COVID-19 in Liverpool has decreased dramatically since its peak in about 11th to the 16th of October. And actually, it was starting to decrease before we went into Tier 3 and before we had mass testing. And that might be a result of what was the restrictions to household mixing that were happening in September, and maybe also people were just doing the right things. As we know, the vast majority of people are, and I think we should be very proud in this city for doing that. And alongside the Tier 3 restrictions and then the mass testing coming in, I think we've seen a real marked decrease in the community cases, and that's thankfully meant that there's been fewer cases in hospital and fewer deaths from COVID-19. Having the opportunity in this city to go and get a test at any time, essentially, and get your results really quickly is a way that we can try and mitigate that risk, reduce that risk to each other. For example, if you are deciding to go out to a restaurant, or if you are deciding that over the Christmas period to go and see someone in their house, as we're allowed to do that period, I think it's a great idea to go and get tested so that you know what your risk is. We know that the tests aren't perfect, but actually for those people who are most infectious and most likely to transmit the infection, the lateral flow test, the quick tests we're doing mass testing, are pretty good.